CMS has issued a proposed regulation to get rid of some of that pesky paperwork associated for some state Medicaid programs. We're going to take a look at what it is, who might be impacted, and the real impact of this proposed change. Now, this is coming out of CMS to further what was called President Trump's commitment to cut the red tape by alleviating states' burdensome paperwork requirements. It all falls under this larger plan to make it more flexible for states to comply with some of the rules of CMS around Medicaid programs and the Affordable Care Act. Here we're looking specifically at state Medicaid programs. The paperwork we're talking about is actually the analysis, the data, and the monitoring required to show if there is access to care and services in the managed care program. Now, if you are a state that has about 85% or more of your patients in the Medicaid program going through managed care, then this applies to you. That's about a third of the states. And what it does is alleviate some of the paperwork analysis and monitoring you have to do of your fee-for-service recipients because you are a largely managed care state. Now, Wisconsin is not one of those states. Wisconsin, where we are, is at about 70% penetration rate of our managed care program. So this will change no reporting requirements or data analysis for our state. It also does, even no matter what your percentage of folks enrolled in a managed care program are in your Medicaid program, it does not change the underlying statutory regulation to ensure that Medicaid recipients have appropriate access to services. It's kind of chipping away at some of the edges and saying we're going to alleviate a little bit of that extra burden you might have had if you're a state that's largely managed care, but then there's also a little bit extra fee for service in your program. So this is what CMS Administrator Seema Verma said. These changes are intended to relieve the unnecessary regulatory burden on states, avoid increasing administrative costs for taxpayers, and refocus time and resources on improving the health outcomes of Medicaid beneficiaries. So she's touting this as a huge overhaul that's going to really save time so you can instead focus on the good provision of quality benefits for your Medicaid recipients. But when you actually look at the language itself, it seems like this is much ado about nothing. They think that the new regulation could alleviate the burden of about 560 hours and save overall just over $1 million, which in the grand scheme of the Medicaid program is pocket change. It's hardly anything. Now, this is a regulation that is proposed, which means there is a public comment period. You can read the regulation yourself. It's posted in the Federal Register, and we'll share that link in just a second. And you have until May 22nd to share your comments. Now, there may be some positive impact of reducing paperwork and burdensome paperwork. In this instance, this does not appear to be burdensome paperwork, and it certainly does not impact the state of Wisconsin. You can read a press release. You can also read the letter to governors on flexibility. Like I said, that broader vision of what flexibility to state looks like coming out of CMS. And finally, we share with you that link from the Federal Register that also includes instructions on how to comment if you choose to weigh in. You can also send us an email and share your thoughts with us, and you can do that at healthwatchwisconsin.org. Thanks for joining us.